So, quickly coming to the focus, I'll request my colleague on the right side, Dr. Nair, to probably highlight what are the key things that he sees from his perspective on the new horizons in healthcare.
Hi, my name is Dr. Ajay Nair and I'm the co-founder of a digital health service called Mira Doctor. We're a service based in Bombay. We serve patients in every state in the country. And what we do is we provide patients with instant, real-time access to primary care physicians across the country. Most of our patients are in tier 2, tier 3, tier 4 cities across the country. And so that's sort of the background I come from. I'm a medical doctor and a public health professional by training. And I've been doing this for about 5-6 years. And I think that as the speakers in the morning have spoken about, IT is probably going to be the most transformative force in healthcare over the next few years. And there are a few key points which will determine how well IT succeeds. I completely agree with the fact that we need a different model for India and we can't copy paste and import models, especially when models across the world haven't worked really well, and we have a very unique opportunity to build a very specific new model for India. And I think just given the fact that private physicians make up a large section of the healthcare system in India, I think that any solutions that are designed have to be designed with the physician in mind. The physician is a very smart professional who wants to maximize their clinical success, and they also want to maximize the utility of their time. And I think the problem with a lot of solutions we see in the market is that, and from purely from a software perspective, it's a user experience, user interaction design problem. That it's designed by an architect or an academic who's not really thinking through what the physician's process is. And I think the solutions that will end up winning are because the large hospitals will adopt something because they do need to adopt something internally to manage large patient flows. But what about all the physicians who are sitting outside of the hospitals? What about the nursing homes? What about independent practices? And I haven't seen many great solutions yet, although there are a bunch that are now coming up. There's a huge wave of startups in the country that are building software for physicians. So I think that it's a great user experience for the physician is really what will end up being the winning factor when it comes to adoption of IT across the healthcare system in India.
Probably one dimension is what new do you see in the recent trend now compared to what has been in the past? I think that's one focus.
So I think a great way to leapfrog the West and other places where you see, because I used to be in the US and I've seen Epic and Centricity and other large IT softwares that are used in hospitals and physicians. One great opportunity we have is that most of our patients as well as physicians primarily access the internet on their cell phones, on mobile phones. And I think the mobile penetration and the fact that you have a supercomputer in your pocket now, because the amount of computing power you carry around in your pocket is basically what a supercomputer was in the 80s and the early 80s and the 70s. And it's using that to actually bring more physicians on. So I don't think it's really a desktop-based model, but it's really leveraging mobile, leveraging the fact that physicians use cell phones extensively, they use WhatsApp extensively, and patients do it too. And so now building solutions on top of that platform is what really the future is, at least in terms of adoption.
I will request Niranjan Amakrishnan to CIO. Gangaram Hospital, I do know Gangaram uses a lot of technology and quite advanced. Could you share some key perspective of a large provider standpoint as to what is the new adoption trend within your own experience?
Good afternoon all. I like to really touch upon some practical approach towards the new horizon in terms of IT in healthcare. One big challenge that CIOs or any technical solution providers were facing in the past were like adoption of IT, doctors not responding, doctors not showing interest, or users are not adopting to the latest technologies, etc. I think we are almost in the stage where it's changing, like where CIOs or head of ITs or the solution providers are not able to understand the technology requirements and not able to fulfill the requirements of the doctors or of the end users. I think we are almost, the kind of changing over stage. Thanks to the conferences, thanks to the vendors meeting the doctors or the department staffs and things like that, or staffs keep traveling. Earlier when we had issues of adoption of EMR, we were trying to tell the doctors how to use EMR in the outpatient clinics, etc. Today the doctors coming up with their own thing, that they want evidence-based medicine, they want like a decision support system on their mobile phones, they want drug-to-drug reactions, everything, and we are not in a position to really fulfill their requirements, honestly speaking. So that's a real change and trend that we are facing from the implementation perspective. Especially like specialty-wise, like specific, specialized products and technology solutions, which is something like we are yet to even bring in properly in the Indian healthcare industry. Maybe smaller clinics and nursing homes, as like morning there was a debate. There, like it is very easy to really adopt these kind of technologies. If we are talking about a large hospitals like Gangaram, for me to get a basic, business process management itself, it's a big challenge. We are struggling to really get the basic things done. Then we don't have enough time to even to look into our like specialist requirements or responding to their requirements. So the new horizons are like really like putting all of us in challenge, because one side we want to keep the business going, the other side we want to really ensure that they have whatever their business requirements or functional requirements are fulfilled. So my inputs as well as the question comment is, let's get the basic done quickly, as quickly as possible, because we may not have enough time to really get back to these things again and again, so that we can really start adopting, whether it's a mobile applications or any other new trends to come in. The basic platform should be up and running, because at the end of the day, none of the mobile applications is going to run if you don't have a basic ERP and HS system properly complemented, implemented, because the basic data is going to come from there. So that's where I think the practical challenges have to be getting the basic right first, before we really getting all these advanced technologies to get implemented.
What comment would you like to make on the cost side of your technology acquisition? What has been the trend and what do you see the perspective in the future?
Just if you, with the personal reference to the hospital, if you really see, I think 3-4 years back we didn't have IT in our annual budget documentation. Today it is in third or fourth stage. So that definitely that shows the IT budgeting is really seriously taken care. And from single digits now we are into 2 digits of budgeting percentage wise at least. So definitely management is willing to really invest on the IT. Only thing is we are yet to really demonstrate the value of investment. Forget about the return on investment. The value of investment we are yet to able to demonstrate. That's the situation.
Thank you. I'd request Dr. Subten from the director, who is a director for CHI, Ministry of Health, to probably speak on his experience at the National E-Health Authority and some practical illustration of new trends impacting the governance side of healthcare.
Yeah, I'll start with the National Health Portal. What are the new things we are bringing in? One, we are also developing mobile apps, in fact, hospital directory, blood banks. One of the things which we are planning, in fact, 1st October is the Voluntary Blood Donors Day. And we are actually trying to, right now we are running a pilot with Delhi and Mizoram states. They are doing a real-time updating of the blood status and the availability of blood, different types of blood in the blood banks. So if that goes on, and there are different states like Maharashtra, Orissa, Rajasthan, who are also doing this. So we are trying to integrate that, because integration I think is a big challenge. Health is a state subject in India. Some states are definitely way ahead. Maharashtra is a good example. And some are way behind. We need not name them. But that's a sad situation. So one of the ways to tackle this could also be, to have a national e-health strategy, which we have not yet thought of. So the National E-Health Authority, the moment it's just set up, I think the first thing to do should be to form the National E-Health Strategy. Now, in this long process of forming the National E-Health Authority, as Rajendra already said, it was in the public domain till May. Comments have been already collected and they are being sorted out. There would be a national level stakeholder consultation somewhere probably next month, either October or November. And definitely, it will be, publicized as well through the National Health Portal. So I think all of you are stakeholders, as is every individual. And as many of you can come and participate in that, I think that would be a great contribution. and we can shape it right from the beginning where it should go. One other major point which we are actually missing, IT is good, internet is great, but in India I think it's less than 25% internet penetration. So that is one area also where this National Health Portal is trying to address. Like whatever information is available in the portal, for those who don't have internet, they can dial a toll-free number. We have a number 1800-180-1104. This is a toll-free number, and currently we are giving the information in English, Hindi, and 4 regional languages. We have in Punjabi, Bangla, Tamil, and Gujarati. So it's available. Ultimately, it will be also available in 122 regional languages, scheduled languages of India. These are just some of the things, but what I feel again, unless we start from the beginning with a robust national health strategy in consultation with all the stakeholders, we may also end up in a mess 5 to 10 years down the line.
So 2-pointer I think I would want you to quickly highlight is the other key pointers in the involvement or the feedback from the public, and what are those, and from the industry, how has the response to the private sector been in your current initiative?
Yeah, actually it was, the comments were invited directly through the various mailing lists and also through the MyGov platform. In the MyGov platform, more than 900 comments came. Of course, of that 400 were not related to it. But even then, I mean 500 is a pretty good number, and we have comments that shows the interest, that people are interested, people are aware. Of course, many were commenting without reading the document because they were saying many of the things which are already there. But definitely lots of people gave excellent insights, and even WHO, I mean agencies like that, they took interest and they sent quite detailed inputs. As I said, I mean we are collating those and going through it, and we'll be having a national stakeholder consultation. It will be a half-day workshop or a one-day workshop, probably in October or November.
At private sector, quickly?
Yeah. Private sector. Most of the responses were from private sector and individuals.
Sure, thanks. So I'll request Aravind from Microsoft to highlight his perspective on the new trend of SMAC, the smart mobility and analytics and cloud, impacting the way how healthcare is, looking at new technology.
Morning, everybody.
Any specific illustration you can, that would be nice.
I'll try to. So, when we're talking about, health IT, I think it will probably work best when IT is empathetic to healthcare. That's the only way health IT is going to work. Otherwise, it's not really going to work. We've been talking about, the role of IT, the role of healthcare, role of doctors, and all of that. But I think the moot point is that IT needs to be empathetic to healthcare, which means that the IT needs to recognize the challenges that are there in healthcare. I think from an India perspective, the key challenge that we have is that of clinical support care, in the sense that the availability of doctors and beds and nurses and paramedical staff and all of that. I think that's the crucial thing that we are talking about. And what we're really looking at is that we are not going to be able to add more number of medical seats or the number of beds as compared to the way the population is growing. So what it really means is that we need to unlock productivity and do more with less. And that is going to be the driving philosophy of IT, from a healthcare perspective. And this is going to be the fundamental to some of the IT mega trends that we are going to be seeing in healthcare. So we often hear of SMAC in terms of social mobility, analytics, and cloud. But the perspective that we have is that from a healthcare perspective, there are going to be 3 or 4 areas that from an IT standpoint that may be relevant. One, definitely from the perspective of healthcare, cloud is going to be a key game changer. In a lot of respects, cloud is probably built for healthcare, in the sense that the elasticity that it offers, the fact that it moves cost from capex to opex, the fact that it has got the elasticity that it requires for things like a sudden breakout of a particular disease or disease management and those kind of things. cloud is perfectly suited for those kind of scenarios. Second is analytics. We talk about digitization, we talk about ERP, we talk about EMR, a PACS system in place and all of that. But truly, unless you're able to see business value out of this, if you're not able to do analytics and if it's not going to help in building efficiencies and effectiveness into healthcare delivery, all of it is really worthless. So the key focus is got to be in terms of clinical, financial, operational, and social analytics can do for healthcare. Couple of other points that would I think change healthcare dramatically. One would be in terms of geographical freedom. We are talking about healthcare largely in the context and the confines of a hospital. That's going to change. And the key drivers of this are going to be healthcare providers themselves and are working on this change. We have, with the objective giving, an anecdotal, illustration in terms of what is happening. One of the largest providers, in India, 5,000 beds, 2 million patients a year, 400,000, inpatients annually, is looking at disruptive ways in saying that how do I reach out to probably 200 million, citizens without having to add the number of beds? And this is possible only if care delivery can be taken outside the confines of a hospital, and we move from healthcare to wellness. And we are talking about this provider building an IT platform which is going to leverage analytics, which is going to leverage machine learning and all of that. A system built in India, built for India, and then which is something that has got a global appeal. So I think these would be the areas that would really impact healthcare from an IT standpoint.
Sure. One quick note, if you can, and if it is visible to you, highlight is many times technology deployment within the health system, whether it is new or old, looks for evidence of benefits. So if there could be some evidence of benefit from Microsoft's experience standpoint in emerging economies like India, that for the largest stakeholder, including government and investor community, would be very helpful, because that is what is actually, though the theoretical perspective of benefits are always there, but when you look at ground reality, you need to really bring those impact points. I think that is the comment. And if you have illustrated, probably some evidence you could highlight that.
I would have a comment on that really, in the sense that I think IT is going to bring availability of data to drive those clinical validations, which is very important today. And IT is doing that, and Microsoft also has a ventures program as a part of which we support a whole lot of startups as well. One of the things that many of these India-based innovations is driving for is in terms of clinical validity. And IT is going to provide the data that is required, to achieve those, clinical validations. And there are several examples of that. Every single, IT solution is striving for, achieving clinical validations.
I'll request MD of Leuven Hospital to highlight his perspective on technology impacting. So we recruited hospital here, and on the new.
Am I audible? Yes. Okay. See, when we think about our perspectives, our thought processes about leveraging information technology or information management in healthcare delivery, there are clearly two segments to it. It is a service industry, and you're looking at service delivery and excellence in service delivery. So whatever we gather in terms of data at this point in time is essentially what we call business intelligence. It gives you a lot of data about how well you are doing in terms of service delivery. It has many data points which it can measure. There's a lot of big data captured. But is this the end all of IT in healthcare? I personally believe no, because we are just applying healthcare IT to improve service delivery in existing organizations and to improve access. To a certain extent, we are using it to improve affordability. But I think the next big leap for the role of IT in healthcare is the role it is playing in the financial services, in educational services. It is all about capturing data, analyzing data, and the power of IT is going to come when we are able to use this analytics to deliver not just business excellence, we have to deliver clinical excellence. In our country, unfortunately, at this point in time, we are not capturing enough data and analyzing enough data to say, yes, I'm working on the delivery segment and the access segment. What am I doing about the quality segment? Where are my quality benchmarks? How am I going to get these benchmarks? Am I capturing data which I can intelligently analyze, even whether it is based on evidence-based clinical protocols? You will find that in most hospitals at this point in time, as we like to say, the service delivery segment or the registration, admission, discharge, transfer, appointment scheduling, I think that is passé in healthcare IT. It has been done in the aviation sector, it is done in the financial services sector. We can pat ourselves on our backs and say we have achieved excellence. We have just achieved what other industries are doing. What more is there? And then your question comes, what is your core business? Your core business is healthcare delivery. If your core business is healthcare delivery, like the aviation sector, what are you going to show me that I am matching international benchmarks? I am the best. This is how safe you are if you come to my hospital. This is what I can deliver it to you in terms of outcomes. Can the financial services sector, whether it is the stock exchanges or whether it is the bank, would you accept mismanagement of your money? Would you accept it going from point A to point B instead of going to point C? You would not. Now that is not just business excellence, it is excellence in your core business. If you look at education, we do the same. What are we doing in India in terms of our core business excellence? What we are supposed to be doing, which is healthcare delivery, are we measuring it? Are we using big data, because there is an enormous amount of data there? Are we really doing data mining? Are we using analytics? It's all fine placing all your information in the cloud. That's wonderful, it stays in the cloud. But the patient still does not have an assurance from the provider that I am delivering the best to you. And how do you show it? Unless you measure it and show it and you have benchmarks, it's not worth talking about. You will be talking about quality, excellence, I have delivered access. But what is the quality I have delivered over there? I can ensure access, but the consumer is looking for excellence, and that is where I think IT now we have to deep dive, our physicians have to deep dive. Traditionally, physicians are very averse to capturing data, particularly performance indication data. If we do not capture that, I think we are missing a big piece of the role of IT in healthcare. We need data, we need to analyze it, we need to define our performance indicators, we need to create more databases, we need to create registries. The business segment, the delivery segment will continue. We have to improve it. But what about quality? Can we really in healthcare stand up and say, I am delivering world-class healthcare? Do we have parameters to show this? In a tertiary care hospital, I am struggling to show it to people. If you look at the government, are we capturing micro data, not just the infant mortality rate and maternal mortality rate? Fine, these are healthcare indicators, but there are so many more indicators which people are looking for. The consumer is looking for this, they look for it in the aviation sector, they look for it in financial services. So this is, I think, where we have to get in, which is relatively untouched.
One quick insert would be, what do you think in your hospital's experience the kind of impact or influence from consumer, a certain class of consumers, if you may, driving technology inward adoption, and is there any specific illustration that you would like to share with this audience?
Yes, I think what Rajendra was mentioning, in our organization, we have begun the process of capturing clinical intelligence capturing performance indicators, benchmarks, and we are actually using this data and putting it up on our websites. We are actually doing what they have done in Europe and North America. We are offering the consumer the choice by telling the consumer, this is who we are, this is how we do it, and this is how well we do it, and this is how others are doing it. So you are empowering the consumer. He may choose you or he may dump you, but unless you put it out there, I don't think just the big building, fantastic technology and some great people may necessarily deliver what the consumer is expecting. They want to look at performance indicators.
Absolutely. Absolutely. Thank you, sir. So, do we have time for one or two quick questions?